guys, welcome to the Sim Center. This is we're doing a little mannequin orientation today over our SimMan3G. This is our high fidelity mannequin that we'll use during scenarios when your program comes in to do scenarios and stuff. We're going to do some of the stuff you might not use in your program, but we're going to do a complete mannequin orientation to show you what this guy will do and kind of go from there. So we'll kind of first start off talking about the monitor. Each room in here has a monitor that interacts with the mannequin. So of course you're gonna have the pulse ox on for the SpO2. So go ahead and put that on. You'll start reading. If it doesn't read automatically, just push the words up here. That one started. Hit right here where it says touch when leads attached. So go ahead and touch it. All touch screen in every room. It'll start showing the ECG popping up. Respirations are already up there, and you'll have your blood pressure. Just hit touch the cuff, click it again, hit start. Blood pressure is going to go ahead and run. This mannequin uses a special blood pressure cuff. Kind of show you here a little bit. I'll take the pulse ox probe off. You have to have a hose. Air hose is attached to the side of the mannequin. So something, just let you guys know that if it does come unhooked, you won't get an adequate blood pressure. So during scenarios, we'll let you know if that comes unhooked, we have to stop it and plug it back in to get it started. But you can get real blood pressures off these guys. Like I said, you can see the vital signs on the screen. Of course, you always want to treat your patient. So you can take real vital signs on this mannequin. If you look up here at the eyes, his pupils will react. So if you kind of cover his eyes a minute, the pupils will react to light. His eyes do blink. Here you can see normal pupils. We can dilate the pupils. We can constrict them. We can make the pupils unequal. One side could be dilated, the other side could be constricted. The mannequin could be tired, and of course could make the mannequin unresponsive, eyes closed. He has ports in his mouth and nose where fluids, if we do have a scenario with fluids, like froth, for difficulty breathing or something, you will see the froth to the side of the mouth, same with the nose. This mannequin has anatomical and pulses just like you and I would. So he has a carotid pulse. Use your two fingers. You want to slide to the side of the neck where the groove is. You don't want to push too hard, because if you do push too hard, it's air driven, so it'll possibly occlude. It could possibly occlude the mannequin, and you not get a pulse. So he's got carotid. He has brachial on the left side only. He has bilateral radial pulses, femoral pulses bilaterally. He has popliteal pulses bilaterally under the knee. He has pedal pulses and dorsal pedal pulses. All of them, like I said, just don't push too hard, because you could occlude them. Besides the monitor, you can take a manual blood pressure on this mannequin. He does have an option, for EMS or somebody that's need to do a crike. You can do a crike on this mannequin. So, like I said, it might not pertain to your program, but you can do a cricotomy. He does have a 4-lead ECG, so if you need to run an ECG or check a cardiac monitor on him, he does have little tabs right here. Top left, top right, lower left, lower right. If you defib the patient, these little tabs here will hook the heart monitor onto. There's one that's down here, one up here. You can listen to lung sounds, heart sounds. So of course in the heart region, listen to lung sounds in 4 quadrants. You got upper, left and right, lower, left and right. He does have bowel sounds. You can't listen to bowel sounds. We can switch any lung sound, any bowel sound to pretty much anything that is out there. As we continue down, on the left side, said the blood pressure, right side. The mannequin has an IV already established. If your program uses or needs to start an IV, we will have a change of the arm out, and we can put an arm on where you can start the IV and go from there. You have the ability to flush the mannequin, push fluids through the mannequin as you're simulating giving medications. Flush the port. There's a tube that's hooked up to the mannequin when you're pushing fluids through, so it doesn't get all over the bed. It goes into a bag hid behind the mannequin. You can nasally and orally intubate this patient. As you look at the mouth and also the monitor, The patient, if he desats or drops below 80% or around 80%, he'll show cyanosis. So you see the monitor shows his SpO2 is low. In his mouth, there's like a blue LED light, kind of a blue tinge, shows cyanosis. So that's what the mannequin is doing. It needs supplemental oxygen. This mannequin will also produce trismus, and also if you're trying to intubate or bag the patient, we can clamp him down where you can't intubate, can't bag. So he'll clamp down where you have to try other options of possibly doing a crike or something else. This mannequin, you can tell, inhales and exhales, so the patient's chest does rise and fall. You can, once you intubate the patient, the chest will rise when the tube is in the correct place. If it's not in the correct place, the belly will fill up with air. You can also needle a chest, so if there's a lung down, you can actually needle the chest, intercostal space. It has the ability to place a chest tube into this mannequin. Either side you can place a chest tube. We've also, certain scenarios require for amputees, we can remove the left arm and left leg and have arterial bleeding. This patient also has the ability to have a seizure. As you can tell, both arms are shaking. Something to do consider, as you're checking the right leg, the compressor is in that leg, so you might have a little mechanical vibration. Just make sure that you can tell the difference between the pulse and the vibration. Just kind of a heads up, let you know that you will possibly have the vibration in the leg. This is where the mannequin plugs into. There's a network cable and a power cord. Try to avoid that area as much as possible. It is secure, but sometimes can come unplugged. With this mannequin, we have the ability to speak with an operator on the other side of the glass, as well as the mannequin has preset sounds. Simulate coughing, difficulty breathing. Interact with the mannequin just as you would a real patient. Mrs. Smith, you okay? Make sure everything's okay. Talk to them, interact. This concludes the mannequin orientation over SimMan3G. When your program comes into the Sim Center, you'll receive a detailed overview of what we discussed in the video. Remember to interact with SimMan, as we call him, just as you would a real patient. Some scenarios may have family members where you can interact with them as well. Take vital signs on him. Anything that you cannot get on the mannequin, the instructor will let you know prior to starting the scenario. Can't wait to see you guys. This concludes the video, and we'll talk to you soon.